Okay, Dr. Gamble. Okay, I'm Linda Curry.
Hey.
And you are Matthew Ormond?
Yes, ma'am.
Okay, nice to meet you.
Thank you. It's my pleasure.
Thank you.
So we are getting ready to stream.
Okay, Dr. Gamble. Okay, I'm Linda Curry.
Okay.
Oh, so that was like what, delayed?
Yeah.
Yes, that's why I have to. Just a warning, YouTube is interesting when we stream live. But in any case, welcome everyone to The Doctors Are In. I am so thrilled to have you here, and I congratulate you because you can be in 50 million different places, watching Hulu, Netflix, or doing whatever it is on these little gadgets that we have. But you have chosen to prioritize your health and your wellness tonight, and I am deeply appreciative for that. I am first going to take care of a little housekeeping. Number one, to ensure that you understand that the information in this session is not intended to replace a one-on-one relationship with a qualified medical professional, and it is not intended as medical advice. The presentation is intended as a sharing of educational information, and we encourage you to make your own healthcare decisions based on your own research and in partnership with your qualified medical team. So that is the first thing that I want to ensure that everyone is able to understand. And then the second thing is that we have a very informal, open format here. Anything goes, literally anything goes. We talk about anything. And the way we would like to do this is you can either let me know, like raise your hand and say that you have a question, or if you're shy, camera shy, you can always type your question into the chat. And or you can also choose to just speak a question, so you don't have to have your video on, you don't have to have your audio on. It's all up to you how much you want to share and how much you don't want to share. Just want you to keep in mind that we are streaming to the internet, as well as we have the recording for those people who are not able to make it here in person. With all of that being said, happy holidays, everyone, and welcome. And who would like to join us with the first question? Who has a question? I know Tony came in first, so I'm going to give him an opportunity, if he'd like, to throw us the first bone.
Okay, put me on the spot for being early.
That's right. Your reward.
Yes. As far as taking medications and things like that, this is a personal thing right now, is swelling knee joint. I have knee issues, and I'm 63 now, and I've been walking on hard decks of ships for most of my life. So I think part of it comes from that. But, the doctors, they wanted to give me cortisone shots and things like that. But I'm like, as long as I can walk and there's, I use ice. That's one question. What's the protocol for ice and heat? Biofreeze, it goes on cold and it's warm. I know for a fact warm helps it. But then again, somebody says that doesn't take care of the swelling. So just might be but an appropriate protocol.
Okay.
So, Dr. Gamble, I'll hop in on this and then.
Yeah, I'm going to throw it first to Matt, who's our resident chiropractor, and then I'm going to let it open for anybody else who wants to address it.
Indeed, because there will be absolutely some nutritional things to consider, Tony, and Dr. Gamble will run with that one. Now, can I ask a couple questions in regards to your knees?
Sure.
Is it both knees? Equally?
No, it's just one. Earlier, I had an Achilles tendon rupture, and they went with the old school. I had a
so they really laid it open.
Full leg cast for a month, and then non-weight bearing for up to 3 months, and that was miserable. But I tried to do that. So my left leg, the one with the knee, it's swollen a little bit. I mean, it stays swollen. It's bigger than the other leg. So.
Yep. And have they x-rayed it?
Yes, the x-ray, they did an MRI, they have done all of that.
And the x-ray shows some arthritic changes in there.
And that's what's arthritic. And they said, I think it's like whatever's between the cartilage between there, there's like practically none.
Gotcha.
They said that deteriorated now.
And the MRI is pretty clean for the most part?
Yes, that's what they said, surprisingly.
Perfect. No, that's wonderful. You know, oftentimes we kind of write off these knees and say, no, this is just old age. You know, I heard you say it's 63. Did I hear
Correct.
that right?
Yes, exactly, sir.
But here's the truth of it: is your right knee is 63-year-old as well, and so it's just not old age. And I want to get that off the table. And I'm speaking to you, but I'm also speaking to all of us. Is we kind of attribute our aches and pains to old age, but literally your right knee is the equal age as your left knee. You mentioned some trauma that's happened there, and that will change. So my perspective from chiropractic, I was raised into the kinesiology sports chiropractic world. So I've had the privilege of working on some top athletes, some Olympians, NFL players, some pretty extraordinary athletes. And in the kinesiology approach, we look at how muscles move bones and bones don't move muscles. And so with that knee imbalance, you'll have a quad, so your thigh muscle, that is not engaging. If you were to go to a gym, and I'm not suggesting you have to go to a gym, but if you were to go to, like, there's the leg extension exercises where you'll straighten both knees up and you're lifting a weight on a machine. If you were to lift, put the weight at 20 pounds and do as many as you could on the right leg, and then try the same exercise on the left side, you'd see a noticeable deficiency on that left side. And if you straighten your knee out, is it painful to do that? Like,
no, I can definitely do that. Mm-hmm.
So yeah, if it's swollen enough, sometimes you can't get it to full extension. But since you have that motion there, my recommendation is just let's build that quad. When you are injured, so the foot and the ankle speak through the ligament and then the electrical system, the nervous system, to the muscles that connect into the knee. And so that's quadricep primarily. So because of the injury, that quad got just disconnected. And so it'll take a little more focused exercise on the quad. So we call them isometrics. So a concentric contraction is like a bicep curl where you lift up, and that's then letting that down is a eccentric. If you hold that bar between those biceps, if you're holding up and staying that pose, that's called isometric. And so for that knee, you might do 10 straight leg lifts without weight. So just in a chair at home on that right side. And with each lift, you'll extend that knee fully or extend the leg fully and hold the contraction for 5 seconds. And then release and then up again and hold for 5 seconds. So do that 10 times on the right side. And I want you to pay attention to what muscles are engaging and what it feels like. You'll feel some ridges and feel some muscles that are there. And as you do the same thing on the left side. And as you'll notice, the left side won't have equal engagement. And so with isometric contraction, you can focus and concentrate and kind of consciously activate muscle groups. And so now we're just practicing, we're rehearsing those muscles, what it looks like to fire on a regular basis. And so that will help strengthen the knee. What happens, I'll just back up one more with a little bit of 3D vision, is that quad, that thigh muscle, if this is the knee joint, that quad comes across and it forms the patella tendon that then holds that knee together.
Right.
And so if that quad is not strong enough, that knee is getting constant micro traumas each time you step. And so over the course of time, you're going to get swelling into there, inflammation and then swelling. And so strengthening that quadricep is going to make a big difference. It won't be one day to the next, but in 2 weeks' time, you can go from a level 5 or 6 out of 10 on a consistent basis down to a 2 or 3 by getting that quad engaged right. And then speaking to heat and ice, the swelling there, you want to get that blood flow back into the area. So when it's swollen, it's constricting blood flow. And the way your body is designed to heal, the way our bodies are designed to heal is getting blood. So blood delivers oxygen and nutrients into those areas. And so maximizing blood flow is going to bring the healing to that area. So I would use heat in this instance. If it was an acute injury, if you told me you were walking off a boat and stepped off a step and hyperextended and it was a sprain, I'd be icing it initially. But because you're into the subacute chronic stage, I would use heat, and it'd be 10 minutes on and then off for an hour. and then on for 10, off for an hour. So we're just trying to, by heating, we're opening up blood supply and flushing blood into the area, but we don't want to over engorge, they call it, engorge the tissue with too much blood. And so that hour between the heating allows the body to balance it out. And then you're going to flush new blood in there again and let it balance out. And so you can drive what we call the inflammatory process. You can drive that inflammatory process and expect some pain relief that comes with that. And so those are some of the initial things without examining. That's how I would typically start with working at a knee, is getting the muscles around there, namely the quadricep, to engage. And honestly, Tony, if you were to lift and do that isometric movement, consistent for 10 to 14 days, you'll notice that muscle starting to turn back on again. You'll notice more stability throughout the day. And what you should notice is less swelling and pain relief in there.
Sounds good. There's a couple things I didn't know, so I've got it written down. I'll try it out.
Beautiful.
Appreciate it.
Yeah, my pleasure.
Awesome.
Dr. Dan, go ahead.
Dr. David, is there anything you would add? You're muted.
David.
Hey everyone, how's it going? My sincere apologies for coming late. I was caught up. I've been traveling today. So,
No problem.
hey, Matthew, and everybody else, how you guys doing?
Hello.
So is
Yeah.
there anything that you would like to add to what Dr. Matt shared?
Oh no, I mean, I think he's the expert where that is concerned. Where the cartilage is concerned, I think I remember Tony talking about the cartilage being missing completely. Well, I do know there are nutraceuticals that are available to help stimulate cartilage recovery and repair that can help. Well, of course, they don't do the work of the muscle strengthening and muscle rebuilding. That has to be done. But when it comes to repair, the actual repair of the cartilage, there are some nutraceuticals that can help to stimulate that recovery as well.
And in alignment with that, Tony, some of the things that Dr. David is referring to are things like collagen and also glucosamine, chondroitin. There's also been research done on things like shark cartilage, So in terms of helping to rebuild that cartilage area, and of course, vitamin C, vitamin D helps with that healing process of rebuilding. And also what Dr. Matt kept on referring to in terms of a lot of inflammation, and we want to make sure that the inflammation doesn't get out of hand. So some of the things that I would definitely suggest in terms of food and nutrition are things like turmeric and curcumin, and also looking at making sure that your water consumption is adequate, because a lot of times when we have cartilage that is shrinking and things of that nature, many times people don't even realize that your ligaments need moisture, needs water, hydration, so that they don't shrivel up, So those are just some things to consider adding to what Dr. Matt has shared. Okay.
Okay, appreciate it. I got another question, but I want to go around the room.
Okay, so we'll open it up for some other questions and then come back. All righty. Anyone else has a question? We have Linda Curry. Go for it.
Yes. I just suddenly started having a pain in my shoulder here.
Yeah.
It's like my rotator cuff, but I don't know how I heard it because I've been inside all the time. I have not been doing anything strenuous at all. Maybe carrying groceries bag, but that's the only thing. So it's just like sometimes it doesn't hurt, and then sometimes it just aches, it just throbs.
Do you have one question?
I mean, I'm talking about it could not hurt right now, and then the next 5 minutes it could be throbbing.
A quick question. Do you notice if it's
It's right here.
Yeah. Do you notice if it sometimes happens when it's raining, when the weather changes? Does that have any effect on anything?
It could be rain, it could be sunny, it could be dry. It just seems to happen, Like something like that, I could pick it up and down, but then the next 2 minutes, it's gonna be tight. I can't pick it up.
Mm-hmm.
All righty.
So
You want to look at that again?
This is right up my alley. And then you guys please
Okay.
fill in the gaps. I love what you did with Tony. So this is perfect. Miss Linda, at nighttime, can you lay on that side without it waking you up and bugging you?
You know what? I can. That's the side that I sleep on. I can't sleep on the other side. So if I sleep on this side, I won't go to sleep. But this side, I will go to sleep. So I'm a left side sleeper.
Yeah, and that's fine. And the pain currently does not prevent you from sleeping?
No, it does that, but sometimes I will kind of pad pillows underneath there.
Okay,
So,
okay. So when you're positioned properly.
But I don't put it all the way under, put like so my shoulder can fall on the pillow.
Gotcha. I guess I shouldn't
So
say properly.
maybe I should change upside to sleep. You think so?
Not necessarily. So I'm just trying to feel into what it is. There's a couple things to consider. Certainly, you mentioned carrying in groceries, that can do it. So I literally call things like that, it's the price of being awesome. So you have done so many things in your life, and literally you have incurred thousands of injuries, whether big traumas or micro traumas. You've incurred thousands of injuries, and with each injury, the body's going to adapt. Just when you stub your toe. What's that?
Go ahead.
When you stub your toe, for instance, the body quickly adapts. That there's muscles that shorten or contract. Some muscles will lengthen to take pressure off that injured toe, and that's just a dumb example of a adaptation that occurs. So you'll have muscles throughout your chest. So this is the upper pectoralis area that will be extremely.
So is this the rotator cuff?
And let me show what I mean. So we have several muscles that make up that rotator cuff, and
right there.
And the pectoralis muscle is such an influence in that
Right
rotator
here.
cuff. Oh, gotcha. Yep. And so that here's the pec muscle. Of course, it comes in underneath the lateral deltoid, and so when it's tight here, look at pull my shirt. Look what it does to that muscle. So you are at constant tension on that side. Then let's say your right side has great motion and no restriction, where this side's at constant tension, and it doesn't take much for you to hyperextend or hyperstretch that muscle out. So you're getting minor muscle strain into that area. So after a nice warm shower, when those muscles are warm, I would rub right through those chest muscles, and you'll find tender spots that are really
right
tender.
Here?
Yeah. Mm-hmm.
Right through here.
Yeah, right through there. And so that will loosen up those muscles. Those trigger points are, as you release them, it allows that shoulder to come back into its proper position. And as if it's in its improper position, it pulls all the way through this musculature back through here.
It doesn't bother me here though. It doesn't bother me there.
Good. That's great. But that's everything that will be involved. It's just like you pull one string, all the other strings have to adapt a little bit. And so that'd be the first suggestion. Next suggestion would be taking a hand towel, so a smaller hand towel, and rolling it up, and then placing it on your bed where that towel goes vertically between your shoulder blades. So if you can picture that, it's going to put you into this position. And we want to get that upper spine back into extension. So everything is pulling you forward, especially if that left side's tighter than right side. You're being pulled forward here, and it causes the shoulder blade to come out, and you may be having trouble with your diaphragm. So that's the breath muscle. So getting that to go back into extension, it allows those muscles to reset their length. So right now, those muscles, your nervous system is so accustomed to that being tight, that is new normal. So by introducing that gentle stretch into those muscles, you'll introduce those muscles to a new normal, which is longer. And a longer muscle, a muscle that's at full length, has more strength. Blood can get into that area easier. And then you could certainly benefit from using heat. And so heat with that same strategy, 10 minutes on, off for an hour, 10 minutes on, off for an hour.
Okay.
And if I were to apply one more concept, and this is pulling from acupuncture information, but that your diaphragm won't be engaging properly. And so breath work. So while you are on that towel that's going vertical between the shoulder blades, take that. It's a 10-minute exercise. Take that time and breathe. And you might, I'm not going to give you how to breathe because there's so many techniques, but find a breath pattern that's comfortable for you, and you'll focus that 10-minute time on just getting good breath in and out. And the diaphragm is engaged best on the exhale. So like I call the diaphragm, when I'm talking to kids, I call it the birthday candle muscle. So when you're blowing out a birthday candle, that's the diaphragm. And if we can get that diaphragm on right side and left side coordinating properly, all of a sudden that support system from the posterior or the back aspect is now supporting. Right now, the tug of war is being won from the front. And so
that makes sense, you know, because I am now working from home and I don't really I don't keep the right posture. You know, I'm not positioned. And sometimes I find myself hunched over into my computer.
Yeah.
Even though it's like, so yeah, that makes sense.
Yeah. So the nightly reset is just that towel vertical between those shoulder blades. And, you know, ideally it'd be on the floor because that floor is a little bit harder. So it gives you a little more extension. But initially I would start it just on the bed. And if that hand towel is not big enough and you want more, then take a regular bath towel and roll it and relax into it and get some breath going on. And that will, you know, again, pain we should see when it's irritating, you might be at a 6 or 7 out of 10. When you get those muscles lengthened and open up that space, when that space is open, blood supply can get into the area and start to heal those tissues up again. So we should see pain reduce in a pretty predictable pattern. So I always say 10 to 14 days is a window where you should be able to introduce that change and expect some physiological reaction that's in your favor.
And one of the things to do, so Linda.
Thank you. Thank you very much.
When you're doing that massage, Linda, take that as a wonderful opportunity to really focus on healing and nurturing yourself. Yeah, you know, so as you are massaging that area, you can use things like almond oil, and you can add in a little bit of wintergreen oil.
Great call.
And wintergreen gives you almost that sensation like icy hot, you know, like hot, cool kind of thing. And really just take that time, as Dr. Matt was saying, to breathe into that area, to expand the chest, to expand your being, and to allow yourself to just focus on nurturing yourself and have that moment of self-care. Because as Matt said, you've been doing phenomenal things all your life. And I know that you are one of these super women that is so consumed with taking care of everybody else. Now it's time for you to take care of yourself.
Amen.
Yes. It's true. Thank you.
All right, my love. Dr. David, anything else that you would like to add?
Oh, no, I do have, I've had, other than what you guys have said, I've had rotator cuff injuries myself from racquetball, but it's not as a result of being awesome. I don't think anyone close.
I beg to differ.
Has been, yeah.
Well, Dr. Matt and I beg to differ, but that's something completely different. So we're going to move along and see if there's any other questions. Thank you, Linda, for sharing that question with us. Any other questions coming in?
Hello.
Hey, Sharon.
Hello, Sharon.
Hi. I had a question. I recently got I had a biopsy of my kidney because I was spilling a lot of protein. Mm-hmm. So it turns out that I have this 20-syllable diagnosis, which sums up to be like
sclerosis. Focal segmental glomerulosclerosis. Exactly. FSGS. Okay.
Whatever she said, Sharon.
Exactly.
Well done, Priya.
Just said.
Thank you.
Where the filters are damaged and things like that. So my capacity is kind of like reduced.
Okay. I can help.
What can I do to maintain what I have left?
Oh, Sharon, you are asking the right person, and she's not even interested in you maintaining. She wants you to rejuvenate. So I'm going to throw it to Dr. Priya.
Oh my goodness. Thank you so much, Dr. Gamble. Such a pleasure. And Sharon, such a pleasure to meet you.
Yes, nice meeting you.
Such a pleasure, Sharon. I was wondering if they told you about how much protein you're putting out in a 24-hour period, and if they have you on any medicines right now. Do they have you on steroids or cyclosporin, or do they have you on rapamycin or any of those immunomodulation drugs, or mycophenolate mofetil, any of these drugs? Do they
Well,
already have you on any of these medicines?
they have me on the
Spironolactone, the
yeah.
aldactone, the diuretic,
Yeah, it's got like
Lasix okay,
and potassium in it.
okay, okay.
Um, and
Potassium
nifedipine.
sparing okay, they have you on nifedipine for blood pressure. Okay.
Yeah, and some other
ACE
like
inhibitors,
losartan.
ARBs, losartan,
Losartan.
ARB.
Mhm.
Okay. Any ACE inhibitors? Do they have you on any disease modifying agents for FSGS, such as steroids or cyclosporin A or MMF or
No, I'm on
rapamycin?
metropolol. Everything else is like for the blood pressure and trying, and to control my sugar. I have glipizide.
So you do have
And
diabetes as well.
yes.
How did they determine that you had FSGS? You said they had they did a kidney biopsy. Did they for sure tell
Because
you?
I had this all started after I had COVID. I was in the hospital for 2
Ah,
weeks.
oh my
Yeah.
goodness. Oh my
Yeah.
goodness. I think you better come to Houston, Sharon.
I think so too.
I think you better. I really
Yeah.
do. And with all due respect, because on January 5th, we are actually starting, what we call a 30-day challenge. And we are
Hmm.
actually looking for people who've had COVID-induced kidney damage. And we want to show that we can completely reverse it with what we're
Hmm.
doing here. So we have anecdotal evidence that we can safely, consistently, and reliably and most effectively reverse chronic kidney disease, even end-stage renal disease. But don't tell anybody I told that to you, because somebody might put a hit from a dialysis unit on us,
Yeah.
on the work that we're doing here. So, but definitely we can reverse chronic kidney disease. And
Really?
yes,
Wow.
yes, ma'am. And
And
I
is
can give you
this
some.
through herbs or medication or combo?
It's a combination. We've created a protocol here at the Immortality Institute in Houston, Texas. And it's
Okay.
a combination of about 10 different things that we do, and we are constantly adding to it. So the most recent additions to the protocol are peptides. And so we have an ever-growing list of things that we do that, for almost guaranteed way can actually reverse kidney failure. Now, it's difficult to use words like guaranteed, cure, and things like that, in the environment in which we practice medicine. But what I
Hmm.
can do is I can share a few stories with you
Okay.
of patient, their own case histories. And I can also point you in the direction of our website, which is kidneyregeneration.life. And I'll type it in the chat in just a moment.
And
It's
also, Sharon and everyone else, what I encourage you to do after each of our sessions, I will always send you an email with a link to the recording, and it'll also give you a link to the website where you can click on the link and you can get in contact with anyone in this panel. So
Yes.
Oh, awesome.
I really, really encourage you to directly communicate with Dr. Priya, because as she said, they are getting
Absolutely.
ready to do a phenomenal study. It's a research project, and she has been able to acquire the funding to be able to do this with a certain select group for 30 days in January. And
Starting the 5th.
yes,
Yes.
starting the 5th.
So
So
about
I
2 weeks
encourage you.
before that, if they could come in, if Sharon could come in and have her blood work done, so we can make sure that there aren't any other sort of contraindications, then what I can say, I don't know what your creatinine is. In fact, that would have been my first question. But what?
2.2.
Okay, so you're at about a stage 3B to 4.
Yeah.
Okay, that's CKD stage 3B to 4. I'm just guessing based on just the creatinine number. I haven't done an actual estimation.
Yeah.
But
It was 5 when I went into the hospital.
understand. So in fact, we've had somebody who had acute kidney injury due to sepsis, who was on dialysis for 10 months, recover his ability to urinate and clear uremic toxins. We've had a 12-year-old child that had congenital kidney disease that was at end-stage renal disease that we have kept off dialysis for more than 2 years with just a few, a few days of our treatment. Then we had another 65-year-old lady with diabetes who was at end-stage renal disease with a kidney function of 12% or estimated GFR of 12 ml per minute, who we got back up to 35, and she remained off dialysis for more than 2 years. I can tell you story after story after story of patients with proteinuria, patients with kidney scarring, patients who are already on dialysis due to acute kidney injury, patients with chronic kidney disease at stage 5, 4. Just to give you an example, my own lawyer, who is a very conservative gentleman here in Texas, very conservative Republican gentleman, didn't know he had stage 3A chronic kidney disease. He didn't even know, because he's a very conscientious sort of person, and climb 300 flights of stairs in the morning and at lunchtime, and only eat protein, and really watched his health in a very intense way, while also working like anything. But then he had stage 3A chronic kidney disease, and we reversed him. We gave back 35% of kidney function back to him. And so he had a chronic fungal sinusitis that he couldn't clear because of the kidney failure, and he didn't even know. So we addressed the underlying cause, and then he was able to fight this infection off. So
Fantastic.
we really can help you, and we look forward to it.
The key, Sharon, is don't walk, run to
Run.
We are waiting to embrace you and to serve you with humility, respect, and gratitude.
Yay.
Yes, thank you so much.
It would be such a privilege to serve you. Please give us the opportunity. Put us to work for you. Thank you.
And Dr.
Okay, thank you so much.
Appreciate you. Kidneyregeneration.life. Thank you, and we look
kidney,
forward to it.
Regeneration.life.
Yes, ma'am.
Okay.
And we're going to provide you with the link, Sharon, so don't worry, okay?
Thank you, Dr.
Okay.
Campbell.
Dr.
Appreciate it,
Priya,
ma'am. Yes.
Thank you.
This is in service of Sharon, but I think in the service of the group as well.
Yes.
It'd be so good to have you share the connection between kidney and heart.
Sure.
Yeah.
Which leads to that, it blows out the nephrons. And then and what's at stake? There's a nebulous, like, I have stage 4 or grade 4 kidney failure.
Yes.
But, what's at stake there?
Could you give me just a second? I have a poster I'd like to bring and show. It'll take me, I have it in the office. Just 1 second, please.
You bet. You bet.
And another thing, Sharon, as Dr. Priya is getting her poster, one of the things I love about working with Dr. Priya is that she is not simply focused on the kidney itself, but she's focused on you. So one of the things that we do together is helping people to look at things in a holistic perspective. And as you go on this journey, I would love for you to also consider the emotional component, where the kidney is related to fear. And to consider if there are different areas of your life, especially since you said that you've had that bout with COVID, and there is that underlying tension of fear that actually literally squeezes the kidney and squeezes the adrenals. Those are some of the things.
Really?
Those are some of the things that we would definitely work through to help to nourish the kidney, to help to open up those channels so that the kidney can expand and have that flow go back to it, as opposed to having it being constricted by the feelings of anxiety and fear. But Dr. Priya, you've got this poster for us to see.
Oh, yes. The poster is not, for some reason, because the backdrop is not showing very well. But I thought I'd just answer Dr. Matt's really pertinent and important questions. And I really appreciate your mentioning that fear is a cause of kidney failure. It absolutely is. In fact, the operative word is exponential fear, like terror. Terror is what causes kidney failure. And what it does is it triggers the sympathetic nervous system, which preferentially diverts the blood supply away from the kidney during that fight or flight response, in which the cortisol is running like a tap out of the adrenal gland. And what happens is there's a huge release of epinephrine or adrenaline, and that diverts the blood supply from the kidney. And so if you think of it as, plants, these filters are like plants, right? When you deprive them of water, what happens? They wilt. And that's what results in that FSGS. FSGS is the final common pathway of kidney organ death. Focal segmental. So that is actually the final common pathway for many, many diseases. And the degree of proteinuria would determine how rapid the progression would be to the end stage component or end stage renal disease, stage 5. Now, protein is like a ball of barbed wire. And if you think of the filter as a filter paper, like a coffee filter, imagine the ball of barbed wire going through that and tearing it. And it, it gets scarred because the protein tears the filter as it goes through. That's why proteinuria causes scarring of all those filters, which means they can no longer filter the blood, which means all the waste substances build up in the body, in the bloodstream, and then kidney failure gets worse. The connection between the kidney and the heart is that's how you get high blood pressure. When you have less blood flow through the kidney, then the body tries to squeeze the blood vessel that comes into the filter a little bit more in order to extract a little bit more juice out of the blood that's flowing through the filter. And that sort of local phenomenon is what leads to high blood pressure systemically, and that puts a strain on the heart. So kidney failure leads to high blood pressure, which then leads to what's called hypertensive cardiomyopathy, which is a thickening of the wall of the left ventricle, with the main chamber of the heart that pumps blood to the rest of the body. That happens because of kidney failure. And then there are many other things we have seen in patients in whom we are reversing kidney failure. Their LDL cholesterol or their bad cholesterol drops by 40 points with just a handful of treatments. Their anemia resolves, which is seen commonly in kidney failure. Anemia is another cause of, hyperdynamic circulation and left ventricular hypertrophy, right? Or this thickening of the heart or this enlargement of the heart, right? So anemia gets better, their electrolytes get better, they put on muscle mass, their depression resolves, they lose fluid weight, they're more, they have more energy, so they're more mobile, their endurance and stamina during physical therapy increases. So many things, everything. Their peripheral neuropathy gets better. Their creatinine improves, their blood urea nitrogen improves hugely, to the point that the nephrologist cannot justify putting them on dialysis. And how long this effect lasts depends on each person's individual body, right? So with your help and with your blessings, we are hoping that we can make this into a drug that will cure kidney failure. But for right now, we are happy to take a protocol that will reverse it and postpone dialysis or postpone the need for a kidney transplant. So Dr. Matthew, what was your other question that you wanted me to explain to Sharon? I'm sorry.
I was just going to have you speak into what's at stake.
Yes.
If Sharon weren't to do anything or were to follow the protocol that she's already on, what's at stake?
Yes, I appreciate your asking that question. That is such an important question. I have, in fact, I get so emotional talking about this because I myself was a kidney failure patient. I had kidney scarring and multi-organ failure at the same time that I had complete adrenal failure 13 years ago at the age of 37. So I nearly died, and I went through the near-death experience, and my adrenal glands had failed due to constant repetitive stress. And the stress was at home, actually. So, and then the kidneys were scarred. And my sister, who's a radiologist, while I was in the hospital dying there of sepsis and multi-organ failure, she looked at my CAT scan and said, "Priya, your kidneys are shot." I said, "What do you mean? I've never heard that before." She says, "Your kidneys look like you've been on dialysis for a long time." I said, "That's the first time I ever heard that," right? So that was the first time I learned that my kidneys, my renal cortices were really thinned out. And so I said, I thought to myself, I had already left nephrology 6 years before because I couldn't prevent I wasn't allowed to prevent progression of renal disease. I wasn't allowed to, there was a lot of things I wanted to do for kidney failure patients, and it didn't work out the way I'd wanted it to. And in fact, my family told me directly, if you're in the business to make money off dialysis, we don't want to have anything to do with you. If you're going to prevent them from going on dialysis, then come talk to us. So I actually walked away from the field, and then lo and behold, 7 years later, I'm down with kidney failure myself. So I guess there was like a spiritual tailspin. Okay, now I understand I had to figure it out, because I didn't want to go on dialysis or get a kidney transplant just like you. So what is at stake is that if we continue with these medicines that will lower the amount of protein excretion in the urine, eventually there will be a need for dialysis. There will be a need for either dialysis or kidney transplant. Neither of these is a cure. As you know, when someone goes on dialysis, the median lifespan is 5 years on dialysis. So dialysis is life-saving, but it's actually longevity reducing. And there is a very good reason for this. Dialysis is one of the most toxic treatments to the kidney. When we put our blood through the dialysis filter to clean out the toxins, it goes through thousands of these plastic capillary tubes. And that plastic generates a lot of inflammation in the blood, because this is low quality recycled plastic, because the cost of the filter has to be low. So people on dialysis are very, 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 very inflamed. They are much more likely to get a stroke. They're much more likely to have a heart attack, much more likely to have an amputation or sepsis or any of those things. And because they're so chronically inflamed, all their numbers are sort of out of whack. Now, if they didn't go on dialysis when they needed it, they could actually die from the kidney failure. So the choice is between somebody dying versus somebody having terrible, almost unacceptable complications of it. So we choose that. We choose unacceptable complications over death. But in reality, dialysis is like setting a fire. If you think of the blood vessels through which dialysis is done as wicks, cotton wicks.
Yeah.
And you think of the filters in the kidney as like cotton balls, like the flower of the cotton plant, right? Then dialysis is like a matchstick.
Okay.
So the fire goes up the veins and the blood vessels, and then it ends in that cotton ball from which these wicks are made, which is the blood vessels. The endothelial progenitor cells are coming out of the kidney. We've been the first ones to show that the kidney is the lead organ in a putative regenerative organ system that exists in the body, and the kidney can make trillions of stem cells and things like endothelial progenitor cells. So what I'm saying is it makes veins. The kidney can generate the cells that makes veins and arteries.
Really?
And so, yeah, and all this is previously unknown function of the kidney. So in adults anyway, I mean, it might be in children.
So Sharon, once again, I encourage you to don't walk, but run to
run.
But before you start running, pick up that phone tomorrow and
please call us. Yes.
Okay?
Yes.
Standing by to help you. And we are so grateful to have the opportunity. Thank you. And thank you, Dr. Gamble. Thank you, Sharon. We look forward to helping you.
Thank you so much.
Thank you so much.
So now, Tony, you said you had another question?
Yes, and Dr. David, I do recall I met you before, but this is a follow-up question. This has to do with sickle cell. My son, again, he's 33, and he's had multiple crises growing up, but it's a little far between now. I mean, he'll have them like every month and a half, and some are bad, some are a little just minor nuisances. Question I have this time specifically, he's on oxycodone, and I'm not sure if it's a high or low dose, but I guess federal law only allows 20-day supply. So he tries to, you can't cut the pill in half or something like that. So literally there are 5 days that he's working through pain and he has to work, and he has a pretty stressful job. He loves it. He doesn't want to, I know that's part of the problem. But my question has to do with marijuana or alternate I guess prescription type drugs. Is there anything that he can do in that line? And he's not on folic acid. I remember last time I heard you talk, folic acid was usually part of the regimen that they do, but he's not on folic acid now. Any ideas that I can have him at least discuss with his hematologist?
So Dr. David, we're going to throw that to you. And for everyone in our listening and viewing audience, Dr. David is actually doing a special sickle cell project in Nigeria starting in January of 2021, where he's working to show that nutrition can actually reverse the symptomology of sickle cell anemia. And the subject group that he's working with is going to be children for the purposes of the study, but he actually works with anyone and can work with anyone who has sickle cell and a variety of other things. So Dr. David, we're going to throw that to you.
Sure, absolutely. Oh, hi, Tony, again. Good to hear from you. You still don't have your camera on.
Yeah, I know. I gotta find my laptop or get a video cam for my desktop.
Sure. Well, I know I saw Dr. Priya raising her hand. I don't know if you wanted to mention anything real quick.
I do actually.
I did.
After you. I can go after you, sir. No problem. I'm happy to go follow you, actually. Or would you like me to go first? I'm happy to. Either way.
Sure, please go
So
ahead.
you might know this gentleman, Dr. David. He is, I think he was one of the past presidents of the American Society of Nephrology, and he is a very highly respected researcher in kidney disease caused by sickle cell disease. And he has actually cured sickle cell disease with patients who have end-stage renal disease with a simultaneous bone marrow kidney transplant. So as you know, the bone marrow transplant is a cure for sickle cell disease.
Yeah.
Right.
I don't know if Tony's son has kidney disease. I mean, I'm coming from
No,
that
he's okay. I mean,
Okay,
they
great.
check
Thank
that
God.
like
Yes.
a lot.
I can imagine.
Yeah.
But I just want to throw that there, and that's about really all that I wanted to add was just that, Dr. David. And I'm sure you've already discussed it with them because I'm sure you've brought that up. So
Yeah, and I know that Tony and his son have explored what you're referring to, Dr. Priya.
Okay.
And
Yeah.
that is not something that they want to progress with. And also with Dr. David, what we are looking at is the nutritional approach because of the fact that it's more accessible financially, particularly in nations such as Nigeria. So once again, Dr. David, I'm going to throw it over to you.
Okay. All right. Thank you. So where is the pain mainly, Tony?
It's in his joints, his knees and his back, his arm, his elbows a little bit, but the primary is his knees and his back, lower back. I mean, it just incapacitates him sometimes.
Is that during a crisis or just?
Yes, during a crisis. He has low-grade pain. And again, the oxycodone does work. And like I said, now I guess it's national. The doctor, the pain doctor, hematologist, can only do 20 days, I think he said. And, there's got to be, he's very responsible because earlier he tried to cut the pills in half and that didn't work. But he's a guy, he doesn't abuse it. And to me, I'm okay. I don't like taking a lot of drugs or prescriptions, we'll say. He doesn't either, but to be functional, he does it. And it's just, it's tough to watch him sometimes.
I understand. He stays with you, obviously.
Yes, now he is.
And he's 33.
Right.
So obviously, over the years, there's been a lot of damage, scarring, regeneration, recovery, healing, and on and on and on and on. So what I would strongly recommend is something to there are nutraceuticals, which are like highly concentrated nutrients that can help to address the inflammation. And if you remember, we talked about inflammation before, because that's really one of the key things that are going on. Although they say in sickle cell disease, they're not really sure what exactly is causing the pain, but we do know that inflammation plays a role there. So it's a nutritional, natural route to overcoming inflammation would be one way to go. In addition to that, we also address the joint areas, the joint problem. So there are nutraceuticals now that are specifically for the endocrine system and the bones and joints. I'm thinking about one in particular that we've used to great success back in Nigeria, where there's severe joint pain and joint damage. And basically what it does is that it upregulates the body's ability to produce the good hormones and the feel-good chemicals that stimulate, that reduce the pain sensations, but at the same time also stimulates joint healing and joint repair. There's another kind of nutraceutical that is specifically for joint repair. But I'm thinking about the one that deals with the hormones as well, because of all the different things that are going on in the body. So there's a specific nutraceutical that specifically does that. So three things. Every person with sickle cell disease has to be on some kind of immune support. Okay. Absolutely necessary, like we've talked about. In addition, you need an anti-inflammatory support, especially in his case. And then he needs this third supplement that I just mentioned now. He may also need something that helps with nitric oxide and blood flow, because that could also play a role in this as well. That's blood flow area. And as we know, as you grow older with sickle cell disease, your blood flow to especially the bones and joints,
right,
and the vital organs becomes more compromised. So that needs to be addressed. Well, like it's a stage-by-stage thing. I mean, we don't have access to all the top equipment and testings that Dr. Priya has access to. So we just have to deal with what is available and what we know is safe. So we don't have to worry about going overboard. So that's what I would suggest. And obviously, I'll be glad to talk with you about it later on.
Okay, so nutraceuticals, inflammation, immune, anti-inflation, and nitric oxide. 1, 2, 3.
Correct. But then for the hormonal aspect as well.
Right.
Make sure that you reach out to him, Tony, through the links that we're going to provide so that he can give you specifics with regards to that. Another thing that I would like for you to consider sharing with your son, and I know it's difficult, especially with the younger generation that think they can abuse all the laws of nature and live forever kind of thing. But one of the things to take into consideration is, how are we driving this inflammation? How are we increasing this inflammation? How are we increasing the oxidative stress? And you said that he works in a very stressful job. So one of the things that I would suggest that he may want to consider, as Dr. Matt said, what is the price of not doing what needs to be done? Because yes, we can use medications, we can use nutraceuticals to basically manage the situation. And we also need to look at what's driving it. So is he getting sufficient sleep? Is he eating properly, or is he eating foods that are inflammatory, foods that increase the oxidative stress? How is he managing his world in terms of his way in approaching life? Does he know how to transform stress? Does he know how to deal with stress? Is he drinking sufficient water? You know, all kinds of things.
He drinks more than a camel, that much I can say. And water, I'm talking about water. I'm like, geez, yeah. Always.
and even if he's drinking water, does it have the electrolyte balance that may be needed? So key essential minerals such as magnesium that helps to relax the cardiovascular system. You know, how much stress is he building up in himself? What kind of relationships does he have in his life? You know, so all kinds of things can be addressed to ensure that we're not just putting a Band-Aid on the solution, on the issue, but that we're really addressing some of the key driving aspects. Because the reality is that we're dealing with a genetic situation. However, we always have control through our diet and lifestyle over the degree to which we're switching that genetic switch on. Dr. Priya?
Correct.
Oh, you know, with all due respect, because I don't know the effect of these substances that I'm going to suggest in sickle cell disease. So I don't know if they've been tried. I don't know if they've been successful, but I would like to humbly add to what Dr. David already said, these are some things that are available here, and they may or may not help in sickle cell disease. But Dr. David, if you'd like to work with me, I can procure some of these things for you to try in Nigeria if you'd like. And then, someone like Tony might also be able to help us with some feedback. So one of them was a peptide called thymosin beta 4, which is a potent reducer of oxidative stress. Potent reducer of oxidative stress. Thymosin beta 4. It exponentially potently reduces oxidative stress, one of the most potent anti-aging peptides, and it's given as a shot. And thymosin beta 4 is typically given as a shot for 6 weeks on, 6 weeks off, subcutaneously. It is expensive, and it's available only from select places here. Even in the US, it's not commonly available. There is a second peptide, which is actually much more commonly used, which is called thymosin alpha 1. And that is a potent stimulator of the immune system. And so both of them are anti-aging and regenerative and potent stimulators of the immune system. But thymosin alpha 1 is very much focused on eliminating the senescent cells in the immune system and regenerating the immune response. And then thymosin beta 4 is very focused on reduction of the reactive oxygen species. And then I wondered if ozonated oil capsules might be able to deliver. Certainly they would help the immune system, but I don't know if they're, honestly, Dr. David, I'm not even sure if they're contraindicated in this condition, but they would deliver oxygen at a more cellular level and can be consumed as capsules. If you would like to try to ask Tony Sunday, or maybe I can, source it for them. If the three of us want to work together to see if it has any effect and if it helps and doesn't harm, then it might be, just something to add to the armament.
Are these prescriptions that you said thymosin beta 5 and thymosin
beta 4?
Well, I'm sorry. Yeah, I'm sorry.
No worries. They
beta
are
4 and
are.
alpha 1. Gotcha.
Those two are prescription, and the ozonated oil capsules you can get from Ozovita, ozovita.com. They're made in Spain and they're imported into the United States.
Okay.
And they're basically things like flaxseed oil or olive oil that are, through which this O3 gas is bubbled.
Okay, gotcha. Wow.
So it looks like you may be taking a trip to Texas also, Tony, and maybe even to California to go visit.
You're very welcome. Very welcome too. Yes.
Yeah.
And then over to Nigeria. So you're gonna be all
I would love both of those trips. Yeah.
Yes.
No, he doesn't need to come to Nigeria. He can stay here and get whatever he needs. He's better off here.
That is the beauty of us working together. I want to once again thank this phenomenal team of doctors that I am just honorably and blessed to be in. Oh gosh, you just
appreciate you so much, Dr.
Campbell. I love the fact we are all here together and we are here in service of you all. And I encourage you, please, 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 when you get the recording, the link to the recording, please go to the YouTube channel, subscribe, click the notification bell, make comments, and share this with as many people as possible. Dr. Priya is doing a project on kidney regeneration. Dr. David is doing a project on sickle cell anemia. We need to get the word out. So I encourage you, please share this with as many people as possible. Dr. David is also looking to help to increase funding for this project in Nigeria. So when you get the access to his website, please feel free to go there and be Father Christmas, Mother Christmas, ho, 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 click the donation button, because the reality is that what he and Dr. Priya are doing are revolutionary, and it is all in service to our community. So once again, I thank you all. And if there are any closing remarks from the rest of our wonderful team.
Yeah, one quick question I've learned from all you, and Miss Linda, thank you, because I got rotator cuff type problems. It's when to sleep, I like the towel the towel rolled up thing. I'm going to try that. And I've got a lot out of Ms. Sharon's questions too. I mean, this is actually pretty good. Pretty
So share. That's the
informational.
whole point. Share. We want this to be like hundreds of people, you know, sending in questions. We are here, you know, each Wednesday at 8, and anything goes. Anything goes. So I wish you all a beautiful night, because as we said, sleep is essential. So it is my bedtime.
Thank you, Dr. Gamble. Thank you so much,
Yeah,
Dr.
thank you
Matt.
all.
Thank you so much, Dr.
Thank
David.
you,
Thank you very
everyone.
much.
Thank you all.
Thank you,
you.
Have a
everyone.
Thank
good
you, Tony.
night.
Thank you, Sharon. Thank you, Linda. Appreciate you so much.